All right, let's talk about Losartan. It's a really common medication, especially for high blood pressure. And in this explainer, we're going to cover all the essentials, from how it works to what to look out for, all based on solid medical information. So, here's our game plan. We'll start with the basics, what Losartan actually is. Then, we'll get into the really crucial safety stuff, who should and shouldn't take it. After that, we'll cover the practical side of things, look at side effects, and talk about drug interactions. And to wrap it all up, we'll answer some of your most common questions. So, first things first, what exactly is Losartan? And what is it doing inside your body to help manage your blood pressure and protect your heart? Okay, so Losartan is part of a drug class called Angiotensin Receptor Blockers, or ARBs for short. You know, the main job of an ARB is to help your blood vessels relax and get a little wider. Think of it like opening up a traffic lane on a busy highway. And because it does that, doctors prescribe it for a few key reasons. The big one is high blood pressure, of course, but it's also used for heart failure. And it has this really cool protective benefit, too. It can help protect the kidneys in people with diabetes. And by keeping blood pressure down, it helps prevent strokes and heart attacks down the line. So the end result is actually pretty simple, but it's powerful. When your blood vessels are wider and more relaxed, it's just plain easier for your heart to do its job of pumping blood around. And that's what brings your blood pressure down and helps your circulation improve. Okay, let's switch gears to a really critical topic, safety. Losartan is great for many people, but it's definitely not for everyone. So it's super important to know if it's right for you. To make sure Losartan is safe, you absolutely have to tell your doctor your full medical history. I'm talking everything. Any past allergic reactions, if you have diabetes, or any heart, liver, or kidney issues. Even things that seem temporary, like if you've had a bout of diarrhea or vomiting, or if you're on a special low-salt diet. All of it matters. And this is a huge one, a critical warning. Losartan is generally not recommended if you're pregnant, trying to become pregnant, or if you're breastfeeding. If that's your situation, you need to talk to your doctor right away to figure out a safer plan. All right, let's get into the practical side of things. How do you actually take Losartan to make sure it's working effectively and you're staying safe? Your dose is going to be tailored specifically for you. For high blood pressure, a typical dose might be somewhere between 50 and 100 milligrams a day. For heart failure, the range can be much wider. But it's so important to remember these are just examples. Your doctor is the one who will figure out the exact right dose for you, so always follow their instructions. The daily routine is usually really simple. It's just one tablet once a day. Try to take it at the same time every day. That helps keep a steady level of the medicine in your body. Oh, and here's a great tip. Your doctor might tell you to take your very first dose right before bed. That's just in case it makes you feel a little dizzy at first. Now, this is something I really want to stress. Even when you start feeling perfectly fine, you have to keep taking Losartan exactly as prescribed. See, high blood pressure is often called the silent killer because you don't feel it. If you stop the medication suddenly, your blood pressure can shoot right back up, and that seriously increases your risk for a heart attack or stroke. Okay, let's tackle the topic that's on everyone's mind with any new medication. Side effects. We'll break down what's pretty common and usually mild versus what's serious and needs you to take action. So let's separate these out. On one hand, you have the common stuff, like maybe feeling a bit dizzy or getting a headache. These often go away on their own as your body adjusts. But on the other hand, there are serious symptoms. Things like your skin or eyes turning yellow, really bad stomach pain, or bruising easily. If any of that happens, you need to call your doctor right away. But what happens in those really rare cases where the reaction is much, much more serious? What does an allergic reaction look like? Okay, this is an emergency. A severe allergic reaction is rare, but it is life-threatening. If you notice any swelling in your lips, your mouth, or your throat, or if you have any trouble breathing at all, you need to call for emergency help immediately. Don't wait. Next up, let's talk about how Losartan interacts with other things. It can be affected by other drugs and even some supplements, so it's really important to know what to watch out for. This is why you have to tell your doctor and pharmacist about absolutely everything you're taking. And I mean everything. Other prescription meds, over-the-counter painkillers like ibuprofen, any supplements like potassium, and even herbal remedies. Mixing these without your doctor's okay can cause problems, either by making Losartan less effective or by increasing your risk of side effects. All right, to finish things off, let's do a quick-fire round and tackle some of the most common questions people have about taking Losartan. First up, the question on everyone's mind. How long does it take for this stuff to actually work? So, while it actually starts working pretty fast, within an hour or so, you're not going to see the full maximum benefit for your blood pressure for about 3 to 6 weeks. So, you got to be patient and stick with it. Consistency is definitely key here. And what about your lifestyle? Are there any things you should stay away from to be safe while you're on Losartan? Yep, there are two main things to be mindful of. First, alcohol. It can actually boost the blood pressure lowering effect of Losartan, which sounds good, but it can make you feel extra dizzy or even faint. Second, watch out for salt substitutes. A lot of them use potassium instead of sodium, and since Losartan can already make your potassium levels go up, adding more can push them to unsafe levels for your heart. So, now you're armed with all the key facts about Losartan. The final question is actually for you. What's the most important thing you're going to ask your doctor to feel totally confident in your own treatment plan? Remember, being an active partner in your own healthcare is the absolute best way to make sure you get the best results.